The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. My name is Krista Brown with the APS Technical Assistance Resource Center, or the APS TARC, and I want to welcome you to this webinar on culturally responsive APS practice with Indigenous populations with our presenters, Dr. Jacque Gray, Marcia Hall, and Sonja Begay, who I will introduce shortly. This is a collaborative webinar between the APS TARC, the National Indigenous Elder Justice Initiative, or NIEJI, and the Office of American Indian, Alaska Native, and Native Hawaiian Programs. And I want to thank everyone for their energy, intention, and wisdom. Next slide. Before we get started, I'd like to share a little bit of information. This webinar is being hosted by the APS TARC, which is a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the federal government. Next slide. The mission of the APS TARC is to enhance the effectiveness of APS programs by working with partners on the use of data and analytics, applying research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing individualized technical assistance to APS programs. We're here to help in any way we can. Just reach out to us using the contact information that will be displayed at the end of the webinar. Next slide. Just a quick announcement. Let's talk APS, announcing a new format for monthly peer support discussions starting this month in October. The APS TARC will now be hosting 2 informal collaborative peer calls each month via Microsoft Teams, one for practice and one for program management. Watch out for announcements with more information on how to register, and you can use our APS TARC Contact Us email for suggestions for topics, or if you would like to be added to the listserv to get these announcements. Next slide, please. Also, a reminder that the National Adult Protective Services Training Center, or NATC, has launched, and the no-cost APS Core Program e-learning courses are available for APS professionals and partners to access. Please visit the website on the slide for additional information. Next slide. Okay, on to some housekeeping. Handouts are in the handout section of your webinar control panel, and you can download those at any time. Please use your computer speakers to access audio for this webinar. Please make sure the speaker volume is adjusted to your desired volume. If you experience audio problems due to internet connection speeds or hardware issues, we recommend exiting the webinar and re-entering. Next slide. You may ask questions of our presenters or share comments at any time by typing them into the questions box, and we're going to get to as many as we can during the Q&A portion of the webinar. This webinar is being recorded, and all registrants will receive an email when the recording is made available on the APS TARC website. It'll be posted, the recording with the slides. All attendees will also receive an automatically generated email approximately 24 hours after the webinar ends with a link to a certificate of attendance. And when prompted, please complete our brief webinar survey. We really appreciate your feedback and hearing from you. All right, next slide, please. All right, well, Andy is going to go ahead and launch a poll for us because before I introduce our presenters, we want to get a sense of who you are. So take a moment to answer the question, what profession do you identify most closely with? Is it APS, medical, legal, research academic, or other social service? And if you don't see yourself reflected, please use the questions box to let us know who you are. So we'll take a few more seconds. Got quite a few votes in already. All right. How about 5 more seconds, Andy, and then we'll go ahead and close it up. Okay, great. All right, so we have a big social service and APS contingent today. So 41% and 43%, and then we also have some medical, legal, and research academic colleagues. Well, welcome to everyone. And then also just came in through the questions box, American Indian Tribal Vocational Rehabilitation. Great, welcome, Rachel. It's great to have you. Okay, so now it's my great pleasure to introduce our presenters for today. And I'm going to be doing brief bios, and I hope all three presenters will share more about themselves as I am just skimming the top, really. Dr. Jacque Gray is the Program Director of the National Indigenous Elder Justice Initiative, NIEJI, at the Center for Rural Health at the University of North Dakota, UND, School of Medicine and Health Sciences. She is also a Research Associate Professor Emerita of the Department of Population Health at UND. Additionally, Dr. Gray is an American Psychological Association Fellow and is part of the Society of Indian Psychologists Council of Elders. Dr. Gray is from Oklahoma and is of Choctaw and Cherokee descent. She has worked with tribes throughout Indian country for more than 40 years in the areas of health, education, counseling, and program development. Her research with American Indians includes elder abuse, health, depression and anxiety, veterans health services, spirituality, suicide, career counseling, and nutrition. We also have Sonja Begay, and Sonja is a policy analyst with the Office of American Indian, Alaskan Native, and Native Hawaiian Programs with the Administration for Community Living, where she works closely with caregiver services and culturally appropriate service delivery. Ms. Begay specializes in issues and concerns regarding grandparents raising grandchildren and the Indian Child Welfare Act, or ICWA. She serves on the Advisory Council to support Grandparents Raising Grandchildren, part of the Supporting Grandparents Raising Grandchildren Act. Ms. Begay is an enrolled member of the Navajo Nation and is a single grandparent raising 3 grandchildren. And we also have Marcia Hall, who is an Adult Protection Services lead for the Shoshone-Bannock Tribes, where she works strictly with elders and the vulnerable adult population, investigating reports of elder abuse, financial exploitation, neglect, and physical abuse. Ms. Hall has extensive experience in preparing and assisting with adult guardianships, elder and domestic protection orders, powers of attorney, probate, and case management. In 2012, she organized and hosted the first Taking a Stand Against Elder Abuse event, which has grown throughout the years to an extended 3-day event, and in 2023, it will be held May 9th through the 11th. She serves on the Area on Aging Advisory Council for Region 5 and the ADRD Alliance. Ms. Hall is an enrolled member of the Shoshone-Bannock Tribes and is a proud pug mama of 4 pugs. So just a quick note about the webinar flow. We'll first be hearing from Dr. Gray to set the stage, and then we'll go into a facilitated discussion with Dr. Gray and Marcia, and then Dr. Gray and Sonja. And then we are planning to have some time for Q&A, share some resources, and then close it out. So Dr. Gray, with that, go ahead and take it away.
Thank you, Krista. And if we can get the next slide. First of all, I'd like to take this time to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken over and inhabited. Past and present, we want to honor the land itself and the people who have stewarded it through the generations. This calls us to commit to forever learn how to be better stewards of these lands through action, advocacy, support, and education. We acknowledge the painful history of genocide and forced occupation of Native territories, and we respect the many diverse indigenous people connected to this land on which we gather from time immemorial. While injustices are still being committed against indigenous people on Turtle Island, today we say thank you to those that stand with Indigenous peoples and acknowledge that land reparations must be made to allow healing for our Indigenous peoples and to Mother Earth herself. Thank you. Next slide, please. I wanted to start out talking about, or giving you a kind of an outline for our cultural sensitivity as far as how we're going to approach some of this today. I'll give you some key information, some cultural issues, approaches to interviewing, and then we'll get into questions with Marcia Hall about developing tribal APS, and questions with Sonja Begay about impact of boarding schools and other traumas that people may deal with in Indian country. Next slide, please. And when you're dealing with a non-Indigenous group, like I'm guessing the majority of people are today, it's important to have some key information as to the complexities that we're dealing with. In the 2020 census, there were about 5.7 million American Indian and Alaska Native, and American Indian, Alaska Native, and some other ethnicity that were counted in the census. About 78% of those lived outside of the tribal territories, many of those in urban areas, because of relocation and moving away from the reservation for jobs and other types of things that would come up. Now, many of those that are outside of those tribal areas may go back and forth between the tribal area and their home in urban areas or other areas over various parts of the year. Also, there are 574 federally recognized tribes in the United States and Alaska, in the lower 48 and Alaska. Now, this doesn't include about 400 that are state recognized or not recognized at all by any government in the United States. It also doesn't include any Alaska Natives, as they're not covered under any of the treaties that deal with the federally recognized tribes and other resources that are provided under treaties with the U.S. government. Amongst those tribes, there are 618 legal and statistical areas for American Indians and Alaska Natives. So this is a lot of different jurisdictions which may be covered by tribal, state, local, or federal laws. But it's different from one to another as to what are covered or who covers the jurisdiction in a particular area or in a particular situation. It varies whether someone is native or non-native, and are they offender or the victim in a situation, as to what jurisdiction will address anything that happened legally as far as those types of issues. Another complication is among all of those 574 federally recognized tribes, only about 100 have a tribal elder abuse code, which is basically their law. And if you don't have a law, you can't really enforce anything that happens. And anything would fall under a lot of the reservations would fall under federal legal systems, but they're very few of those cases ever go to through the court system. So we have a lot of things going on, a lot of complexities, lack of the codes and the resources to do enforcement. And in a little while, Marcia Hall will talk about, trying to develop an APS program from scratch with no resources or anything else, and how she was able to really pull something together with the Shoshone-Bannock Tribes. So we'll talk, having this key information is important as we move forward talking about some of the issues. Next slide, please. I also wanted to address a couple of definitions. Many times we hear people talking about elders and working with elders. Well, in Indian country, the term elder is very different in how it's interpreted. So we have elderly, which may be an older adult with the age determined by the tribe. So in some tribes, it may be 55 or 60 or older, depending on many times the life expectancy of those in the tribe. So elderly is more just an age-oriented determination. Elder, on the other hand, with American Indians and Alaska Natives, are revered people who provide wisdom and leadership for their tribes. They show grace, wisdom, and gentleness in their daily words and actions, and are usually above the age of 60 to 65, although that also varies from tribe to tribe as to who is considered an elder. They also many times are the carriers of the culture and the wisdom of that culture to be shared with the younger generations as they come along. So it's very important to understand the differences between those. And I'll be talking more today about elderly than I will be about elders. Next slide, please. So one of the things that we've developed and is available on the NIEJI website is a curriculum on cultural sensitivity. And the link is there as far as accessing that curriculum. But some of the things that are important is to give you an idea of what historical trauma is and how that historical trauma, which may be from boarding schools, from being placed on reservations, by massacres and other things that occurred in the history of each tribe that impact those generations going forward. So you'll get a little more information about what that is as a foundational issue. Also about adverse childhood experiences, or ACEs. And we deal with a lot of that. There's a higher number of ACEs among American Indian, Alaska Native populations than among other ethnic groups within the United States, which involves different types of child abuse and neglect, and lack of resources that may impact that child all the way into adulthood. And we know from the research that also impacts health and longevity. It also includes socioeconomic status and social determinants of health. Excuse me, I start losing my voice very quickly. So the socioeconomic status on many of our reservations, I think some people saw during COVID with some of the things that were covered. There may be lack of running water, lack of electricity, all kinds of factors in terms of housing or multiple generations of families living under one roof, where you have a lot of demand on any household. That also impacts the health. And so all of those things come into play. And then we're starting to do more land acknowledgement statements like I gave at the beginning, where we recognize the land that we are on. And because this is national, usually if I were at a conference or somewhere doing a presentation, I would address the land acknowledgement with the tribes that were the original people that lived on the lands where we were having that conference. Because this is national, we make it a lot broader to where it covers the lands where all of you may be residing at this moment. So all of those things are important in understanding cultural sensitivity. When you're working with people from a particular tribe, it's important to get some information about the history of that tribe and the things that have gone on and impacted that tribe over the time of colonization up to present day that may have an impact on your interactions with them moving forward. Next slide, please. When we talk about interviewing clients or as far as elder abuse, there are things within Indian country that are important to remember. First of all, we don't go in asking about abuse. If you ask about abuse, no, it doesn't happen. So we talk about disrespect. And are you being disrespected? Has someone disrespected you, and how? And getting to the stories about that. Same way with sexual abuse. You don't, if you ask about sexual abuse, nothing ever happened. It never occurred. You won't get anyone to talk about it at all. But we found that using the term bothering helps to get to the issues around sexual abuse. And, just, has anyone bothered you? Would you tell me how? You may get information that isn't abuse, but you may also get those stories of things that did occur. It's always important, if you have someone come into your office, to be a good host, to offer them food and drink. Tell them a little bit about who you are. You need to be able to give something to expect them to give something back. So that's important, to make a connection. Who you are, how long you've lived in the area, what your connections are. Those types of things are very important when you're asking an elder to share things with you. And then listen to their stories. Those stories are how we communicate things, and you'll get a lot of information and a lot of detail from those stories. If you don't interrupt, just let them tell the story. It takes a while. Sometimes it'll take hours. But it's important to listen to the story. And then I've got some of the things I talked about as far as how you might approach asking a question. Next slide, please. So next, Marcia, if you can come online. There you are. So tell us a little bit about who you are and your background.
Hey. Hi, everybody. My name is Marcia Hall. I'm an enrolled member of the Shoshone-Bannock Tribes. I reside on the Fort Hall Indian Reservation here in Southeast Idaho. For the past 13 years, I've been the Elder Adult Protection Service worker. I cover all 5 districts on the reservation. And we have close to about 6,300 enrolled tribal members. That's not saying that they all reside on the reservation, but the majority of the individuals that I serve are either suffering from domestic, physical, emotional neglect, medical neglect. And so basically, that's pretty much my premise when I go out. And just like you were saying, it is so true about knowing who your audience is. making that connection with them so they feel more at ease, allowing you to come into their home because that's their sanctuary. One of the things that I find really interesting is going back to knowing who your audience is. Like for instance, my background, my family we're one of the largest families on the reservation, which is the Buckskins. And so when I do my interviews, I introduce myself, and then usually the question is, well, who's your family? And a lot of times, people will, I learn more about who I am and who I come from the elders that I interview. Back in 2012, going back, I actually started the first Taking a Stand Against Elder Abuse. It was a mechanism to try to get the word out there as to what the code entailed. One of the things about it was a half-day event. Now, this past year, we actually exceeded 26 tribes in attendance. We had 13 states in attendance, including Canada. We're really excited about next year's event because we're looking at a 3-day event rather than a 2-day event. The one thing about it is that I'm really excited about in 2018, in order to establish a better way of providing services for the membership, is I organized a multidisciplinary task force with the assistance of my coworker, Velda Evening Smith. And we formulated a task force with about 10 to 12 individuals stemming from our police department, our emergency, EMS, as well as our diabetes program, elderly nutrition, our housing, and we also have our nurses as well as some of our council members. And it's nice because we kind of get our general idea on who we need to service so we're not overlapping and meeting one person in conjunction with one person. In the past would always get like 4 or 5 people, but this other person wasn't getting no services. So this is a way for us to kind of oversee and maintain that everybody's getting seen and what services are needed to be implemented in those homes. The other thing that I'm really excited about, but when the pandemic happened, we weren't able to actually start this process, but we've got the policies and procedures ready to go, and that's our community board of guardians. A lot of times when we run into individuals that may not have a family member available to make sound medical decisions on their behalf, usually we look at either a board of guardians off the reservation. With this opportunity, we will actually be able to have interested members making decisions for those individuals. So we would be able to take care of our people on the reservation. This would cover like our fiduciary as well as our medical guardian. And I'm really excited when we get that going because it's a needed vessel in order for us to continue with the care for some of our elders. One of the unique issues working with adult protection services in Indian country is there are times that not only do we deal with one person, but we deal with the family as a whole. An example would be, like for instance, our family, when one person is in the hospital, you have every person there at the hospital in the waiting room. And it's not just one person makes the decision, it's a unit that makes the decision. So that's one of the things that I find unique working in Indian country. The other one is a lot of times we have individuals that are intermarried with other tribes. And so we could have, for instance, like for my situation, my father's from Nevada and he's Shoshone-Paiute, but my mother is Shoshone-Bannock. But we have some people who have more stronger traditional roles, such as we could have somebody from Montana and have a Shoshone-Bannock tribal member. And sometimes the children or even the families infuse more of the maybe the Montana beliefs rather than the Shoshone-Bannock's. So that's one of the things that I find interesting, because sometimes we are taught a certain way, but it doesn't necessarily mean that that's the only way. There's other ways of looking at things. Also, our traditional practices. I go back to the whole aspect of working with elders. They're very sensitive. And when you overstep your bounds and don't allow them to be the teachers and the leaders, sometimes you can overstep and hurt their feelings. That's why a lot of times, I mean, when somebody asks what should be done in a circumstance, or maybe even, for instance, for myself, a lot of times I look at their guidance to address an issue. So I'm not disrespecting somebody or vice versa. I'm being respectful and addressing things in a way that would make everybody more comfortable, as well as appreciative of the efforts. And going back to the, when I started the Adult Protection Services here on the reservation, we had it back, the tribe actually enacted the Elder Adult Code back in 2009, but we didn't actually enlist the program until the 1st of 2010. When I came aboard, basically it was, there was no training, and I can tell you it was like a sink or swim. The first thing that I did was I looked at the code and tried to understand it. I was really lucky and fortunate that when I started the program, I actually was working under the tribal court's prosecutor's office. So there was an individual that was an assistant prosecutor that kind of advised me and guided me throughout the process on how to construct guardianships, protection orders, power of attorneys. And so from there, it just kind of grew. And I was really lucky because doing some research, I was fortunate enough to make contact with the area on aging. And of course, they had an adult protection program. So I started making contact with them, started meeting with them every Thursdays. And to this date, after 13 years later, I'm still meeting with them. We have a really strong bond coordination of services that has enhanced not only our tribal membership, but also including them in the task force alone has been beneficial, because a lot of times we have services on the reservation that a lot of times we run out of funding, but the state level where we're counted, we can actually utilize those fundings, which sometimes we're not aware of it on the reservation, but they're aware of it off the reservation. So it's one of those things that you have to network. I mean, I can't say enough. If I didn't go out and network, I think that we would be still sitting stagnant. Because when I first started, I didn't have no budget. There was no room for travel. There was no, I mean, basically it was just like, okay, here you go. This is the code and this is what we need you to do. And that was one of the I would say it was the most difficult tasks, because I had no way of knowing if I was doing right or if I was doing wrong, but it was what the code had stated. And I refer people back, if you want to start an APS program, you got to make sure that there's a code. And you can actually go to the NIEJI.org site, because they have a step-by-step guide on how to construct an elder code. And they also have examples from the different tribes that you can actually follow that and make it into your own tribe to address those issues. The other thing too that I thought was really understanding was basically going out there, and I wish there was more opportunities for tribal APS to have trainings, because when you go to like off-state training, they don't, like for us, they don't have somebody that they actually will have the civil system do all the filings, and such as doing the protection orders. They have somebody that does that. They have somebody that does the guardianships. And so, but for us, we do everything and we take it to court. And so we're a little more broader in that aspect. And plus you're dealing with the cultural aspect of making sure that sometimes when I do have non-members, sometimes they kind of feel turned off by not wanting to share because they feel intimidated that they're going to be removed from the home. And it's like, no, these are our friends. And so I try my best to try to implement more of their presence so that they can actually come in and be seen as, I'm here to help. I'm not here to disrupt the family. The other issue, the unique issues, especially where people who live off the reservation, is just the mere fact that sometimes when individuals live off the reservation, sometimes they infuse more of a diverse culture, such as if they live in a predominantly more like Hispanic area, or maybe they're more diverse to not understanding where they come from, which is from the reservation aspect. Sometimes, I mean, for instance, in fact, we were talking about this. Sometimes people think that you have to be traditional and you have to dance, you have to powwow and all of this. And that's not necessarily making you a traditional person. It's just making you be more affluent with your traditions and cultures. But in an urban atmosphere, I mean, I think to me, it gives them a prime opportunity of learning about where they come from and having that ability to reach out to some of the elders. You know, our elders on our reservation, I mean, they're our most sacred individuals. And a lot of times we don't look for their guidance or their assistance. Many times we kind of just dismiss them because they may be slower, they may be hard of hearing, they may be not wanting to attend a lot of these functions. But in the same sense, we need to reach towards them because they have lived through a lot of these circumstances. You know, it's funny because sometimes, for instance, like my elderly mother, teaching her how to use her cell phone for the first time was a learning curve for me because, you know, it comes so quickly for me, but I had to remember my audience. And but the other thing about it is understanding that sometimes individuals, when it comes to our like for instance, going back to the discussion that I had with the ladies earlier, we have individuals that still to this date don't utilize, like if they're told that you need to use this type of medicine for diabetes or whatever the circumstances is, sometimes they rely on their own concoctions to get over a headache, to get over sicknesses and stuff. And I remember growing up, we never wanted to be sick around our elder family members because my grandmother, she had every possible symptom or medicine that would cure a headache or, you know, so many times we didn't miss school. But for a lot of it, it just goes back to understanding your audience. And I wouldn't trade this job for anything. I mean, I grow into every year when we do the elder event, it seems to be interesting because everybody starts from the same circumstances. We all want what's best to improve our living situations, to improve the communications with outside sources, to enhance services for our tribal members, and also making our elders happy and safe. So I'm always available for questions. I mean, like I said, I would love to be a resource for you if you have any type of needs. Like I said, starting from square one, where and to where the program is now. I mean, it's been a whirlwind of changes and tribulations, but I wouldn't trade it for anything because I've met some incredible people, and I really enjoy the successes of the fact that I can see some of our elders smile and be thankful for just the small successes. And so, but that's all I have to say. Thank you.
Thank you, Marcia. I know one of the things I forgot to mention earlier were, there's so much variation because there are states where the tribes are sovereign and take care of all of their court issues and things like that. There are other states that are referred to as 280 states, which is Public Law 280, where part of that sovereignty is ceded to the states, and the states investigate and follow up on all of the legal issues. So some of those things that we have to keep in mind. So thank you again, Marcia. I think you gave us a real insight into what it looks like trying to work in tribal communities. So we can have the next slide, please. And Sonja Begay with the Navajo tribe will tell us a little bit about, there you are. Good to see you, Sonja. And thank you for joining us. And tell us about who you are and your background and some of the things that you can share that impact our elders in can be looked at as abusive and neglectful.
Okay, well, thank you so much, Jackie. Thank you very much. Well, good afternoon, everyone. Once again, my name is Sonja Begay. I'm an enrolled member of the Navajo Nation, Tachini no Tatanep, Northern Cheyenne, Denebashachit, Tohalina Dashache, and Tachini Dashanala. I'm truly humbled to sharing my personal recollections of my parents, my life, and these are basically some of the things I've never spoken about publicly. But I think with this audience that we have, it's very important that anyone who works with Native people have to listen and hear some of these words that I'll be speaking today. To start off, both my parents were basically taken into the boarding school system when they were 8 years. One is, I think, 8 years old and 9 years old. They lived on the Navajo reservation in Arizona. At that age, they were taken from my grandparents and they were shipped to Riverside, the Sherman Institute in Riverside, California. My dad and my mom they really don't talk about it, but based on what just their recollection, it's very humbling to see where I've come from and to understand what trials and tribulations they had gone through. But to start off, I would just basically tell you that I was born in Los Angeles, California, and I was raised in a Latino community. While I was raised in this area, I was never told I was Navajo, and I was never told I was Native American. Though during this time, my parents, they would take me and my sister back to see my grandparents on the reservation, but it was very confusing for us. Our upbringing basically was going home, help grandpa herd sheep, help grandma make bread or whatever. And it was a very difficult time because we didn't speak the language and we were never taught the language. And so when we went out, I used to go ride a horse with my grandpa and herd sheep. And so he spoke no English and I spoke no Navajo, but we seemed to communicate pretty well. What I think in all essence is that with this type of upbringing, we were there for a week or two and then we just went back home to California. And we still didn't know who we were. All we know was it was grandma and grandpa. But one of the things that was, I think when we got older, we started to see that we were very different from the people that were there, which was mainly family members and people we would see at the trading post. They would talk about us because we were dressed differently. We smelled different. We acted different. And sometimes I used to get rocks thrown at me because I just was just not part of the community. They knew that we were Navajo, but we were just an oddity. So growing up and going back home was very strange to me, and it was very difficult at times, and it got pretty harrowing at times because we just didn't know. But anyway, so that basically leads up to just the experiences that my parents had at the boarding school. But what I would like to start with is as perspective from my maternal grandmother. She, during her 80s, I used to go back there, and one of my cousins would basically translate for me. I understand Navajo. I can speak very little Navajo, but to have a conversation with her, I needed somebody to translate for me. But one of the things she shared with me, and I had asked her about, how my parents had left the reservation, and it was very heartwarming for her to talk about it, but she cried during this whole conversation. But anyway, she said, I'm going to get emotional because I'm thinking I can see her face. But anyway, she told me that these people came to their house, and she says these white people came to their house and asked how many kids they had. Mind you, this is probably the 1940s or maybe 50s, maybe early 50s and 40s. And my grandma couldn't understand, well, I've never seen you before, and I don't know why you're here. But they would come and they would leave, and then they came back a couple of days later, and they told them that they were going to take her kids, part of the school age, to school, and they'll be able to feed them and stuff like that. And she didn't think anything of it. And then between her and my grandpa, they decided, well, maybe that is a good idea, that the kids need to go to school. But one thing they didn't tell them was that when they took the kids to school, that they were going out of state. They just took the kids and they left, and they never saw them for about almost a year. So, it for some reason, I kept thinking to my grandpa, what did you do? What did you have to say? She says, you couldn't do anything because we didn't know where they were. So until the time when they did come back, that, it was very hard for my grandma to figure out that these kids are different now. They have short hair, they barely speak their own language, and they just are not the same. So they were kind of shunned upon themselves until they had to go back to school. But after my mom had said, after she kept several times coming back, or she did come back, that she just felt like she was not part of the family anymore, which is very, very bad in that essence. So that brings me up to my mother. She was very limited in her conversations about her experiences at the boarding school. How my mother was very abrupt. She was a strict disciplinarian, verbally, physically, and emotionally. She never showed any emotion, especially physically. She was a seamstress in her working profession. I know that she worked at a young age sewing at the boarding school. And I asked her, well, what did you do when you were there? How did you learn how to sew? And she never said anything. She just told me to get lost. But anyway, so I asked my dad. And my dad said during that time that they would be sewing things, and they were like shirts. And he said that they had I guess it was like a garment factory type of atmosphere. And the ones who were old enough to learn how to sew on the machines would be sewing. And then come to find out later on that they were actually uniforms for the military. So in essence, I thought, well, why did they do this to these kids? Because they were young. I think my mom said she was about 11 years old. So just to be sewing and working like this was, and for the military at this young age is unheard of, especially now. But I remember asking her if she could show me how to sew, and because she was such a good seamstress. And one of the things that she was very, like I said, she was very sharp on her criticism. And every time I made a mistake, it was either a harsh comment, or she slapped me on the back of the head, or something like that. But after a while, I said, forget it. I'm not doing this no more. I have to learn just by myself. But also later on in my age, when I got into my teen years, she wouldn't let my sister and I go to dances or social events or go out with our friends. We just felt like prisoners at our house. But she always made references that, you know, we were going to get in trouble or get pregnant or somebody's going to do something to us or we're going to run away or, you know, just some of the comments was unheard of. But so a couple years later, I had asked her, you know, she was probably in her 70s at that point, why she didn't let us go out. And she had told me that she was molested in the boarding schools and she did not want this to happen to us. So, you know, so to harbor all these feelings and harbor all these things to us, she basically just kept us in a cage, and that was the end of our story. So at 17 years old, after I graduated from high school really early, I just went to apply for university and I left. I went to the next state over. But it was hard because she kept saying, well, she's going to get this and this, and she's just still very harsh. But anyway, I didn't realize this, that my mother was basically molested and she was carrying this and it was torturing her inside and the effects it was having for her at this point. But anyway, one of the things that I think I came about was this, that she never showed emotion. She never hugged us. She never kissed us. She never did anything like that. And so it was very weird at some point, I think in my later years, that I realized that if somebody came and hugged me, I think I jumped. It was kind of funny, but it's not funny when I think about it, but because I had never had anybody hug me or just give me that affection, like, you know, they really like you, blah, 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 and they hug you, and you're just like, you know, you just jump. But when I was telling my dad about this one time, he says, because my mom was always the one who got hurt, she was always the one that got hit. So then I thought, you know, all the things that she had encountered in her early life and her days in boarding school were the days that she had to go back home or whatever, that was portraying, she was putting it back on me and my sister. So me and my sister at some point just decided this cycle has to end. We have to learn how to be good people and learn how to hug your children, be compassionate, how to do these things. And it was very difficult because we didn't know how to do that. And that's a very sad situation. So that was just from my mother's upbringing. But also now, my father passed away last year, but he would talk about certain things but the boarding school, he didn't really go into detail. There's things that just from his actions or some things that would come about. That's when I would ask a question from him. But he told me he worked in a machine shop in the boarding school, and there they had worked on aircraft parts. But he told me later on the reason why they had him working in there is because his hands were small enough that they can get into little places where people couldn't get. So, you know, no matter what the circumstance was, he said that if we were under scrutiny, we had to work like this, and this is why we were there, just to work. And I won't say it was for the military or whatever it was, but it was just mainly, a child at that age should not be doing stuff like that. But one of the recollections I do have about my father is that we were watching the Schindler's List, and we were in the movie theater. He wanted to see this movie from Steven Spielberg because it was one of his favorite directors. But one of the scenes that it just literally got to him, it was the part where they were dousing, I guess it's the lice powder or whatever on these people and cutting their hair. And my dad got up and left. I thought he went to go to the restroom. He didn't come back. And this movie is very long. So I went to go find him, and he was sitting in the car. And I asked him, I says, are you going to come back in? He says, no. He says he didn't think it was going to affect him, but it did. And when it did, it was just basically, he said he could see the smells, the noises, and the pain from removing his hair. It came back to him at that time. And I kept asking him, is it the military? He says, no, it was because when he was in the boarding school in Sherman that they used to do that stuff to them and be very horrible to them. And he said, that's what kind of gave him the notion to say, well, I can't go back in there. And so just to be traumatized like this, just at your early years, come back into being an adult and see your children, and it's like, how are you supposed to function? But so anyway, to share these things, like I said, I have never shared this before, but I see a lot of our elders are in Indian country who basically don't say anything. They're the same age as my mom and my father. And what trauma they have gone through if they had to go to boarding schools, or even if they didn't go to boarding schools, what they have to encounter. So it's very important, I think, for anybody who works with in these systems, who works with elders, is to see them and to understand the things that they had to encounter and the things that they had to live through. And it wasn't just, oh, they had, just a bad experience or whatever. This was an ongoing daily thing, especially when they were in boarding schools. We talk about historical trauma, and that's a prime example of historical trauma. It went from my grandmother to my parents, and then to myself. And I truly wanted my kids not to experience something like that, and then to my grandkids, because no one should have to deal with that. And like I said, our upbringing wasn't the best, but at least we had a house a house to live in and stuff. But we ended up going to school and making something out of ourselves. So I have my grandkids that I'm raising now. My son was murdered in 2010. So I see that I share these things with them so they have a better understanding why. Sometimes I don't stand for a lot of nonsense, and I don't stand for a lot of things, especially for people who can't help themselves and or just, in areas that, other people will put them down. So they know that that's what I do as more of my job, or advocating for the grandparents raising grandchildren. But I think I always tell my kids, I said, you have to understand we are very unique. We are Diné. We're from the Navajo Nation. We're one of 574 federally recognized tribes. We have a culture, we have a heritage that's very unique in our background. But you have to see that other people that we know, they might be from Oglala, they have their ways. And then there's some people that we know are from Micmac, or some people who are Ojibwe or whatever, but they have their different ceremonies. They have their other ways. And so always respect that. Never have a better understanding of the people that you're around. And I think, once again, people who are working with our elders in these particular situation, protective services and stuff, have to remember this. Respect the person that you're looking at. Understand that they have a very unique background, but also, too, listen to what they have to say. You might not, like Jackie and Marcia were saying, some of these discussions might not be immediate, but you might take a couple minutes, but you just basically sit there and listen. The terminology has to be a little bit different, and be sensitive to what they're trying to tell you, because you can't just come out and blurping and saying, was that person bad to you? Was that person bothering you? Or are you being bothered or something? It's just the terminology that you need to use. I think also, too, is that we have to listen to the family structure. The family has to be a component. Not just an individual, it has to be a component. You have to listen to if there's, like within my family, we had the problem with my grandkids being taken away from their parents. We went as my dad, was my mom, and my sister, not my sister, but myself, and then their uncles. We all sat at a table and we just came as a troop, and how can we make this family still stay together and don't separate us? Because these are our generations, and this is what we're here for, to stand behind everybody. So that, like I said, it's just very interesting just to be part of this particular webinar. But I think also, too, it's very important that we listen and understand that our future is looking at certain things, but then also our background is what justifies who we are. But anyway, I think that's basically all I have to say. I could say more, but I just wanted to make sure that I got those points across without crying or whatever. But thank you very much for listening to me and listening for my sharing of my words.
Thank you, Sonja, for sharing all of that. And I know they aren't comfortable things to talk about, but they're things that we need to have people understanding what the older adults they're working with in tribal communities have been through that may be impacting what's going on with them now. I remember stories that I've been told about going out to investigate child abuse with a grandmother raising a grandchild, and that she had slapped the child. When they got there to talk with her, you know, they were talking with the grandmother about why she slapped the child. And she held up her hand, and she only had 3 fingers. And what she explained was when she was in the boarding school, the first time that she spoke her native language, she was beaten. The second time she spoke her native language, they cut off 1 finger. And the third time she spoke her native language, they cut off another finger. And she said her granddaughter came home because in the schools they were trying to revitalize the language, and she came home speaking her native language, and the grandmother slapped her because she was trying to save her the pain that she went through.
Yes, most definitely.
You have to get to those stories because it wasn't just child abuse.
Right.
It was a reaction to all of that trauma that grandmother had been through.
The generational trauma is there, and we don't want to we recognize it, but we don't talk about it. And I think that's one of the things that we do have to talk about, because even with our language, with me, my language, my son knows some of the language. He can introduce himself in Navajo. We're trying to pass it on to the kids. But I think it's very important that when they go back home and go back to where we come from, that people even there should be very sensitive to who we are, because we didn't make that choice to stay off of the reservation. It was because of my parents and their upbringing and what they had to endure. So,
yeah. So thank you. And Krista, do we have some questions? We can go ahead and advance.
Yes, we do. Thank you so much. I just want to say that, Sonja, there is just an outpouring of gratitude, and just so much thanking of you for sharing your story. I just am seeing comments like eye-opening. It's resonated with other folks that had similar experiences with their grandmothers or their parents. And so thank you for that. Before we get into the questions portion, very, very much appreciated. So we are at the questions portion. So if you do have any questions for any of our presenters, let us know. We did have a couple come in as we were moving forth. And Dr. Gray, I think this one probably would be best suited for you. So Gail shares, I was informed that we are practicing more cultural humility than cultural sensitivity, and this is due to the lack of sensitivity. So do you have any comments on that? I know that we use a bunch of different terms across a bunch of different fields, but what are your thoughts on that?
Well, and cultural humility is where you recognize what you don't know, and you're honest about what you don't know. And you're sharing more about yourself and allowing that person to share about themselves, but you're not putting other things on them. And so coming from a very humble mindset in saying, I don't know that much about your culture and I don't want to be offensive. Please correct me if I do something wrong. And, it's not always saying, teach me, but at the same time, being open to, how can I make this a better situation for you? You let me know what you need. And coming from that, not that I know what your culture is and how things should work, but that, I recognize that I don't know these things, and I don't mean to be offensive or anything, and I want to be here to help in the best way that I can. So let me know what kinds of things I can do to make this easier for you. As Sonja was doing, how can we make it easier for you to tell your story?
Great, thank you. And Latrice is sharing in Humboldt County, and Marcia, this probably is related to what you shared. In Humboldt County, California, we often do joint visits with tribal social services, which helps with building trust and the ability to collaborate for joint efforts that may be above tribal social services capacity. And then in California, there is something called Home Safe, which is can help with either a housing insecurity or if someone has already become homeless. So anyway, so Latrice just wanted to share, or yeah, she wanted to share that. Any comments?
Well, it goes back to the whole thing when I do coordinate services with the Area on Aging, Adult Protection Services. We do collaborate and do those home visits together because it's always about safety. And it also not only safety, but it's also the barrier of having a non-Indian in a Native American home. Sometimes having that ability to create a more safe environment to allow that elder or vulnerable adult to feel more comfortable with a stranger in their home versus somebody that has an authoritative, appearance. And so I think that's great. Collaborative efforts are always the best.
Great, thank you. And then this actually might relate, Marcia, to you as well. So Amanda is sharing, it's usually a policy not to accept food or drink from clients. Actually, Dr. Gray and I talked about this initially, but would this be seen as a form of disrespect if a client has offered this to the caseworker and this client lives off the reservation? Do you have any thoughts on that?
I've had elders in the past. I had an elder that actually made a pie, and they wanted to thank me for assisting them in their matter. And I shared it with everybody else rather than accepting it because I didn't want to be disrespectful. I think it depends on the circumstance. I mean, like a lot of times I always tell people, well, let me buy you a drink, or a lot of times if I'm getting myself something, I usually will get them something. But I rarely, it's not about disrespect. It's like a lot of times, I think it just depends on the circumstance. But a lot of times, I'm usually the one that'll offer them a drink or offer them something to eat versus even like in our office, we have a water cooler, or sometimes if we have snacks, like, would you like something? But yeah, that's kind of a touchy one. I think it depends on the circumstance. But a lot of times, it's usually the norm. But something as simple as a drink, or I think something to snack on, I don't see a problem with that. So,
Great.
Yeah.
Dr. Gray, go ahead, Marcia.
But I don't want them to overextend themselves,
Right.
Like if it's their last dollar, I wouldn't feel comfortable with that. So
right. Dr. Gray, did you want to, since we did have that conversation about
and it's not uncommon for them to offer, especially, something to drink, a glass of water, a cup of coffee. It doesn't have to be anything extensive. That, just that honor, or that sense of they're being hospitable.
Yeah.
And to refuse that is saying you're refusing their hospitality. So even if you don't drink much of the cup of coffee or the glass of water or whatever, accepting it and sipping it or whatever, to just acknowledge that they're making you feel welcome in their home.
Right. Thank you. So any other last minute questions, please come on, go ahead and share those with us. Let me talk about the next slide. I'll talk a little bit about the resources that we have put together for you all. So as Dr. Gray and Marcia talked about, NIEJI has a plethora of resources. So I have only picked out some of the ones that I thought were the most relevant to this webinar. Around the Tribal Elder Protection Team Toolkit, the Tribal Elder Abuse Codes and examples. Marcia talked about that. There's training. There's a YouTube channel. And grandparent resources as well. Also, NIEJI has partnered with the National Center on Elder Abuse to do some really great publications. And then what was shared with me recently by Dr. Gray and our presenters is that the Federal Indian Boarding School Initiative has released their first investigative report. And so there's a link there as well. And then a video that was shared with us as we were planning this is a video that is well worth watching. And it is by Dr. Dawn Warren on the impact of unresolved trauma on American Indian health equity. And it is health equity and so much more. So I would recommend checking that out. And it looks like we do have another question. So from Brian, is there any in-person training for APS? So this is probably a NIEJI question. So Dr. Gray, did you want to?
We have available on our website a number of training modules. We really set them up for tribes so that they're very accessible across different platforms, and you know, a lot of places don't have broadband or anything like that, so we wanted to make it where it didn't take up much bandwidth to be able to look at them. So they're not videos, but there are some stories and things like that integrated into them. We have those on the policies, legal, financial exploitation for health workers, medication issues, social services and caregivers, and also a general one on elder abuse and the different types. One thing I didn't talk about is within Indian country, when I first started speaking about elder abuse, I had elders coming up to me and asking, what about spiritual abuse? And so we've also included information about spiritual abuse. We've done an article and published it on spiritual abuse with Native American elderly. So, you know, there are a lot of things out there for that. Also on NIEJI's YouTube channel, we have a series of videos of, actually they were our Zoom trainings that we did with the Shoshone-Bannock Tribe APS in talking about different things for them to keep in mind when I was doing some training with Marcia's staff. Other than that, NIEJI will be coming to an end the end of December, the end of this year. And there'll be another group taking over that contract. But we are working on migrating all of those resources that we have on the website to ACL so that they will continue to be accessible for different ones to utilize.
Great, thank you. And along that same line, Dr. Gray, are there resources, Rachel would like to know, are there resources specifically for addressing substance use disorders among elders? It is so often tied to trauma that we were discussing. Does NIEJI have anything specific?
The module on medication issues does deal with substance abuse. as well as, alcoholism, the various types of substances, depressants, stimulants, opioids, all of that. So there's a lot of information in that module. Beyond that, I think there would probably be more through and this is another grant program through SAMHSA, the National American Indian Alaskan Native Addictions Technology Transfer Center. And it's all out of the University of Iowa, and they have quite a few resources on substance abuse and mental health issues with all ages.
Great, thank you. And this probably is a question for all of you, but Janet's wondering, have you all also worked with people with intellectual and developmental disabilities, or in APS parlance, dependent adults, in addition to elders? So Dr. Gray?
We have not specifically, but a lot of the same types of approaches would need to be done with developmental disabilities. Of course, there's differences in, as those that work with that group a lot, as far as interview techniques and things like that, as far as getting information. I know more so with elderly, we get into the dementias a lot of times and trying to get information. And I remember I end up getting stories, all the time when I speak from different people, and of a man that suffered from dementia in the nursing home. And he would fight them whenever they would try to give him an enema. And so he would be held down by multiple orderlies. And what they found out later on was that he had been sexually abused in the boarding school, and they'd hold him down to sexually abuse him. And so it was taking him back to all of that trauma. So, you've got to be very sensitive to what those traumas may be that they've been through in trying to access that information, because they can't always tell you. And I think you find the same way in how they would go about telling you with those that are developmentally delayed. We see a lot of FAS, FAE types of issues in Indian country. And, with those disabilities, how they communicate things may be different than you're used to hearing them. So you have to be open to how they may communicate that to you in a different way. Marcia,
Right.
do you have anything to that?
And just to clarify, so is that fetal alcohol syndrome?
Fetal alcohol effect.
Okay, great, thank you. Yeah, Marcia, any thoughts?
Yeah, I was just going to reiterate a little bit about what Jackie had stated. Currently, we're working with a nonverbal Down syndrome individual. And the one thing about it is that I found that's unique is having the different family members that have more of a one-on-one connection with her, because myself trying to form that response back, it doesn't happen. But relying not only on developmental disability services to pick up the pieces to offer her services is the key. The other thing about it is just making sure that, especially going back to our multidisciplinary task force, having those appropriate personnel that know how to address those issues, because I'm not going to fake like I know what to do in a situation, especially dealing with somebody who's nonverbal, but they're more equipped to handle that. So the more the better to understand this individual's needs is always key. And also involving that family that can give us a better history of what entices this individual for speaking or verbally, non-verbally giving impromptu signs and stuff. Is you have to have that in order to get that point across. So
Great, thank you. And then I just, one last comment. So Gail is sharing a frustration around just the lack of Wi-Fi for certain rural and reservation and frontier populations, and how so much is moving, so much of our service communication is moving to social media. So if you don't have those connections, how therefore can you either access social media and or access an online form to register for something? But I don't know if Sonja or any of you want to comment on some of those disparities around broadband access.
Well, and one of the things we did when we did some training in Alaska a few years ago was to download all of those modules that we had developed onto a flash drive and took them up there to where they didn't have to have the broadband to access them. And so we gave those out at the training for them to be able to use. So finding ways, and we really worked with NIEJI to find ways for the various needs as far as access to be able to utilize it as much as possible.
Great, thank you. Any other comments, Marcia or Sonja?
Well, like here, like for instance, the last, I would say, how many, 6 or 7 months, we as a tribe have been actually having difficulty with our web contact. Our internet is down, sometimes it's up, and sometimes our phones don't work. And so a lot of times, you know, we are resorting back to, okay, well, I'm going to do a letter and I'm going to hand deliver it, or I'm going to pick up the phone and I'm going to call somebody on my cell phone. And so a lot of times, you know, we have to ourselves kind of be in somewhat, I guess, basically we have to think outside the box. Like, instead of relying on our technical issues, we need to think out. I mean, like, okay, well, now I have to pick up the phone, or I need to walk over there or drive over there. And so maybe that's a good thing too sometimes, because I learn more having one-on-one interaction with individuals versus sometimes even relying on trainings, because then I can sit there and I can ask those questions, and you know, just like this webinar, I can ask those other questions that I might have stemming in my brain, and have that opportunity. And sometimes it's always nice just to visit and network. So but I can totally understand that frustration. So
Marcia, was it your group when they shut things down with COVID that gave all of the elderly 2 pieces of paper, one green and one red, that they could stick up in their windows? Or it was it was a different group then, that they gave them, you know, these pieces of paper, and they put the green one up in their window if everything was okay, and they could put the red one up if they were needing help. We're going low tech.
That's as low tech as you could possibly get, but that's great.
So I'm driving down the road, could see those pieces of paper in the window and let someone know.
That's great. Sonja, did you have anything to add about the broadband?
I did have just something to share. I think initially, being that some of our elders have to be grandparents, raising their grandchildren or their caregivers and things of that nature. There was such a demand that, okay, first now you have all these kids going to school and they have to have access to the internet. It's like, well, we never had to have internet before. Mm-hmm. So I remember a tribe that it's either Washington or Oregon, I believe. They had indicated that the one thing that they had to do is, because there was such an overwhelming amount of information that they had to get. They said the elders couldn't do it. They didn't have the internet. They just ended up going door to door, you know, with the mask on or whatever, handing packets. It was interesting. But while they were handing packets, they made sure that they had extra food. Here was a food basket to go, and here, make sure you guys have something to eat. But then also too, this is the schoolwork for this week, or for, you know, whatever. And back to having the green paper and the red paper, we have to go back to something like that, because at this point it's very difficult to get this broadband to the amount of people that need it all of a sudden. So that was one of the things that this particular tribe had to do, to be very creative, make sure that the kids were able to go to school and be not lag behind. So
great, thank you. Oh my goodness. Well, I think that this has been such an incredibly rich presentation and discussion. I think that we will thank you all, Dr. Gray, Marcia, and Sonja. Thank you so much for partnering on this webinar with me. It's been a great pleasure. And from the comments I'm seeing here, there's nothing but gratitude from our audience folks as well. So just to close out today, thank you all for coming and joining us for this discussion. You can find all of the TARC contact information and the follow us with social media and everything else. And if there's anything that you have a question about as a follow-up, please go ahead and contact us at the apstarc.acl.gov, and I will make sure that either Dr. Gray, Marcia, or Sonja get that, and we'll continue the conversation. So thank you, everybody, and have a great rest of your day. Take care.